Taoiseach, do you have a special advisor on disability matters, or have any of your special advisors ever suggested that you heed the call of disability organisations and advocate groups for your department to coordinate implementation of UNCRPD and disability matters generally? Because, I mean, we have people dealing with different aspects of disability across a whole series of departmental silos, and as a result, really, we do not have a rights-based approach to disability matters in terms of the UNCRPD. I mean, for example, I met a woman knocking on doors the other day who was saying about her son who has Down syndrome and is constantly has her medical card reviewed, his medical card entitlement reviewed. Or in our own area at the moment, there's a service, door-to-door transport service called ACTS for people in wheelchair users and mobility issues, and their lack of funding means their entire service to several thousand people with mobility issues or who are wheelchair users who can't use public transport are going to lose their service because of the lack of a relatively small amount of money. And I could go on. And the problem is that all of these things are dealt with by sort of subsidiaries of departmental silos rather than having a coordinated approach, which I think your department should lead to ensuring a rights-based approach to disability matters in line with the implementation of the UNCRPD.
In terms of Deputy Boyd Barrett's points, one of the big innovations of this government was to move disability from health as a core responsibility to the Department of Children, Equality, it's a long title, and disability as well, to try and give a singular focus to the disability question. Now, operationally, the HSE obviously will be involved in terms of delivery of services, but from a policy perspective, that there would be one key department that would have the function of coordinating and developing policy and initiatives for people with disabilities. And, you know, you've referenced a Down syndrome child, for example. I would have thought the child would have domiciliary care allowance. So I think they should have automatic entitlement now to the medical card, certainly to GP. But I think that's certainly to GP services. I think I'd have to check it, but that shouldn't be happening, in my view. Shouldn't be happening. But then there's a cabinet subcommittee, the Social Affairs Committee, which has dealt with disability in the past, and is an opportunity to coordinate with other government departments. It is an area that demands coordination at the same time, from transport to work to education, right across the board. There's a need, and one of the bigger areas I would be interested in, I'm interested in all areas of special needs and disability, is employment, for example. I think that area needs to be really worked on much more proactively in terms of getting agencies, government departments employing more people faster in respect of disabilities. Deputy